In a world of miracles, we have forgotten the cost of precision. We've built machines that can see inside the human body, decode its chemistry, even predict disease before it strikes. And yet, for millions of seniors, modern medicine, that gleaming temple of technology and expertise, is failing them. Not because of what it doesn't know, but because of what it refuses to see. This is the story of how and why our parents and grandparents are being misdiagnosed at alarming rates. A hidden epidemic, buried beneath data, paperwork, and the illusion of progress. This is the dark side of modern medicine. Long ago, medicine was an art. Doctors knew their patients by name, not by chart number. House calls were common, and listening, truly listening, was the primary diagnostic tool. But as medicine evolved, it traded empathy for efficiency. Today's hospital is a cathedral of screens. Data pulses through every hallway, monitored, logged, analysed. The promise, accuracy, speed, science without error. The reality, a system too complex for the human beings inside it. Nowhere is that failure more evident than in the treatment of the elderly. Because in the algorithms of modern care, aging doesn't fit. The numbers are staggering. Studies suggest that as many as 1 in 3 seniors are misdiagnosed during hospital stays. For some, it's a medication side effect mistaken for dementia. For others, a heart attack disguised as indigestion, or depression dismissed as just old age. The consequences are not academic, they are fatal. Misdiagnosis accounts for tens of thousands of preventable deaths among seniors each year. We call it diagnostic overshadowing, she says. A senior comes in with confusion. Doctors assume it's dementia. They stop investigating, but it might be an infection, dehydration, or a drug reaction. By the time they realise, it's too late. In the race for efficiency, subtlety has been lost. Modern medicine sees symptoms through the lens of probability, not individuality. And when you are 80 years old, the system's probabilities aren't in your favour. To understand how we got here, we have to look inside the machine, not the MRI scanner or the heart monitor, but the bureaucratic machine that governs modern healthcare. In hospitals today, doctors spend more time staring at screens than at patients. Electronic health records, insurance codes, billing templates, every click is monitored, every minute logged. The average physician has less than 10 minutes to evaluate an elderly patient with multiple conditions. Think about that. 10 minutes to distinguish between medication toxicity and early Alzheimer's. 10 minutes to notice that a minor cough is the first sign of pneumonia. 10 minutes to prevent catastrophe. Diagnostic errors aren't born of ignorance, they're born of exhaustion. Doctors are overworked, nurses understaffed, and seniors are the ones who fall through the cracks. For younger patients, illness often presents by the book. But aging changes the script. A senior's body doesn't play by the same biological rules. Fever may not rise in infection. Chest pain might not appear during a heart attack. Instead, symptoms hide in plain sight. Fatigue, confusion, mild nausea. Medicine loves patterns. It searches for predictability. But aging erases the patterns doctors are trained to see. It blurs the line between disease and the natural wear of time. And so, the data betrays them. Test results might look normal, even when something is catastrophically wrong. Machines can't measure the nuance of frailty, the decades of slow decline, or the quiet desperation of someone who knows their own body better than the chart does. There is another, darker force at work, one harder to quantify: ageism. The elderly are invisible in a system designed for the young. Medical schools devote less than 3% of training to geriatric care. Pharmaceutical trials routinely exclude those over 75. And in hospital wards, complaints from seniors are too often dismissed with a condescending shrug. "You're just getting old," the doctor says. "That's normal at your age." But pain is never normal. Confusion isn't just aging. These phrases aren't diagnoses, they are dismissals. Each one a quiet betrayal of the Hippocratic Oath. In a healthcare culture obsessed with youth and cure, aging is treated as failure, and that bias seeps into every corner of care, from triage decisions to the design of medical devices. The system doesn't see seniors, it sees complications. Another culprit hides in the medicine cabinet. The average senior takes more than 5 prescriptions daily. Many take 10 or more. Each drug interacts with the next, creating side effects that mimic entirely new diseases. Fatigue becomes depression, tremors become Parkinson's, confusion becomes dementia, and so begins the cycle. New pills for old symptoms, new symptoms for old pills. A spiral of over-medication, misdiagnosis, and dependency.
I was taking 17 pills a day.
This is not negligence, it's fragmentation. Each specialist sees a piece of the puzzle, but no one holds the picture. The cardiologist treats the heart, the neurologist the brain, the endocrinologist the hormones, but the patient is left somewhere in between. And when the body reacts unpredictably, the reflex is not curiosity, it's assumption. Technology was supposed to fix this. Artificial intelligence, predictive analytics, machine learning, the new saints of modern medicine. Yet even these tools carry their own blindness. Algorithms learn from data that rarely includes seniors. When models are trained primarily on younger, healthier populations, they misread older ones entirely. A heart rhythm that's normal for an 85-year-old might be flagged as dangerous. A subtle warning sign could be ignored because it doesn't fit the expected pattern. In this sense, the future of medicine is haunted by the same ghosts as its past: bias, omission, and neglect. We have built smarter machines, but not necessarily wiser ones. There's an irony at the heart of all this. The more advanced our tools become, the less we seem to trust the simplest one, the human touch. Listening, truly listening, is still the most powerful diagnostic technology ever invented. It costs nothing, it requires no updates, and yet, in clinics worldwide, it is the first thing sacrificed to time. One study found that doctors interrupt patients within 11 seconds of them speaking. 11 seconds, before an elderly patient can even describe their pain. In that interruption lies the seed of every misdiagnosis. When we listen less, we understand less. When we understand less, we assume more. And assumption is the most dangerous drug in medicine. Consider Mary Thompson, 82. She arrived at the emergency room confused, disoriented, and trembling. Doctors diagnosed advanced dementia. Her daughter begged for more tests and discovered a severe urinary tract infection. Within days of antibiotics, Mary was lucid again. Or Samuel Green, a retired teacher whose chest tightness was dismissed as acid reflux. 2 weeks later, he was dead from a heart attack. The signs had been there, but the doctor, distracted by lab results and time pressure, never looked him in the eyes. Each of these stories reveals the same truth. Modern medicine is brilliant at treating diseases, but terrible at treating people. Doctors themselves are victims of the same machinery. Burnout rates are at record highs. Many feel trapped between compassion and compliance. The system rewards speed, not accuracy, procedures, not patience. We're taught to treat the chart, not the person. In this environment, mistakes aren't aberrations, they're inevitabilities. And seniors, with their complex symptoms and fragile health, bear the heaviest cost. So what can be done? The answer begins with awareness and humility. We must confront the uncomfortable truth that progress has outpaced empathy, that the pursuit of perfection has made medicine mechanical. But there is hope. Across the world, new movements are rising: geriatric training programs, slow medicine clinics, and hospital reforms designed to centre the patient, not the process. In Italy, doctors spend extra time with each elderly patient, focusing on history and environment as much as lab data. In the US, age-friendly hospitals are being certified by the hundreds, emphasising respect, tailored care, and communication. These initiatives don't rely on new technology, only new priorities. Because at the heart of it all, medicine was never meant to be a transaction. It was meant to be a conversation. The challenge before us is not to reject modern medicine, but to humanise it, to rebuild trust between doctor and patient, to remember that data is only as good as the compassion behind its interpretation. Imagine a future where seniors are no longer treated as complications, but as teachers, each one a living library of resilience and history, where technology supports intuition, not replaces it, where every diagnosis begins not with a screen, but with a question. How are you feeling today? Those 5 words, spoken with sincerity, could save more lives than any algorithm ever written. In the end, the story of misdiagnosed seniors is not just a medical crisis, it is a moral one. It asks us what kind of society we wish to be, a society that values efficiency over understanding, or one that recognises that the final chapters of life deserve as much care as the first. Every year, thousands of elders are lost not to disease, but to indifference, their symptoms overlooked, their voices unheard, their pain minimised. But it does not have to stay this way, because medicine, at its core, is not about machines or metrics. It is about meaning, and meaning begins with attention, with the courage to look beyond the chart, with the simple act of listening, fully and without judgment. The dark side of modern medicine is not technology, it is forgetfulness, the forgetting of what it means to heal, not just to diagnose, the forgetting of the people behind the patients, but the light is still within reach. All we have to do is remember.